Back on Open Line, our final full segment with Dr. David Aronoff from Vanderbilt University. And we want to get right back, try to get in as many calls as possible. We'll begin with James on line 5. Hi, James.
Hello.
Go ahead.
I was just wondering, for people like me that do have a strong immune system and might have felt like they got it back in January, but just had a mild effect from it, possibly. I don't know, but I have talked to people who felt like they already had it, possibly. If they never got tested or anything, and say they went and got tested now, would it come up on a test saying they've already had it?
Good question.
Yeah. James, thanks for asking that. Well, we do know that the test that we use from the nose or sometimes from the saliva that tests for active infection can remain positive even longer than we are contagious. So, for example, most people who aren't hospitalized but have COVID-19 are contagious for about 10 days, assuming that their symptoms are improving. But you can still detect pieces of the virus in their nose or sometimes in their mouth, even for weeks or months later, despite the fact that they are not contagious. And that's one reason why the CDC has recommended against repeated testing within the first 3 months after you've recovered from COVID-19. So it's possible if someone was infected 2 months ago and didn't know it, that they could still have a positive test today without symptoms. The other testing that I think you're alluding to, James, is antibody testing in the blood. And that is a bit of a mixed bag, because it turns out that people who have mild infection or no symptoms tend not to mount a terribly vigorous immune response in their blood. And so they may not get a measurable antibody response in their blood, or if they do, it may not last very long. And even people who have pretty severe disease and end up in the hospital can lose their antibody in their blood. It doesn't mean they're not immune, but they can lose the antibody in their blood after several weeks to months. So it's quite possible that someone could have absolutely had COVID-19 in March after it arrived in Tennessee, and not gotten tested. And by now there's really no way to document that, because their antibodies are negative and they're no longer shedding virus in their nose or mouth. And that's a big challenge for people who are left with chronic symptoms after COVID-19. Thank you for asking that.
Yeah, great question. Appreciate it, James. Let's go now to Mike. Hi, Mike. Welcome. Go ahead, Mike.
Hey, Mike. Hey, Mac. I had my grandfather went up at the VA twice with a COVID-19. And I got him home the second time. We gave him a bottle of Robitussin. He's out there digging holes. I got his granddaughter right here. What's your granddaughter doing?
Mike?
If she's digging holes, I don't understand.
What's that? Oh, hold on, Mike. Let me go on to. I've got Mike on line 6. Let's go to Linda on line 2. Or no, this is James. Go ahead, James. Sorry. James, you there? All right, having a little trouble. Hold on. Now we'll try Linda. Linda, are you there? Hello, Linda. Hi, thank you for calling. Go ahead. Sorry for the mix-up.
Okay. I just have a couple of comments, and I was wondering about the doctor's opinion of it. First of all, Trump every day keeps saying, this is going away, this is going away. And a lot of people believe him and follow him. I think that's one of our problems. I mean, every day he's saying this. And also, I don't think there's been enough reporting of younger people who get the virus and don't survive it. Like last week, an 18-year-old healthy young man got it.
Right.
And because the younger people, for some reason, think, it's okay if they get it because they'll be okay. But I think they should, make public more younger people that it really does affect.
And Linda, younger people just tend to have that kind of invincibility mentality. Because they're young and they're overall healthy and have a lot of energy. And let's go to the doctor and hear what he has to say. Doc?
Yeah, Linda, thank you for bringing all of that up. I mean, certainly we are also hopeful that this comes to an end. Right now, what we're seeing in the United States is disease activity increasing, and we're experiencing that here in Tennessee and here in Davidson County. And, you're exactly right that, yes, older people are more vulnerable to dying of COVID-19, but we are losing lives of young people, and there are young people on life support right now in our hospital, teenagers who are struggling to breathe and requiring a life support to stay alive. I think in the state of Tennessee so far, there have been over 20 people younger than the age of 30 who have died from COVID-19. And, every one of those people was somebody's son or daughter or husband, wife, or partner who's not with us anymore. And it doesn't take seeing more than one of those to motivate me to do everything that I can to help stop this pandemic. And that's why I'm so appreciative to be here tonight and so honored to be with Rhori Online.
Real quick, we will go to one final. We got less than 2 minutes, but Sean has been holding patiently. Sean, go ahead.
I'm so appreciative to be here tonight.
Sean, turn down the TV. Yeah, go ahead. There you go.
Okay, yeah, my name is Sean.
Yeah.
And, I suffered a DVT back in March.
A DVT?
Yeah.
Yep.
Yeah, and it took forever for it to go away, and the infection, I had to be hospitalized for it.
Okay.
I'm just wondering here, just recently I got sick again for 2 or 3 days right there, and I went to the emergency room, and they, suspected that maybe I had COVID-19, but they had never tested me. And I was just wondering that if I did have COVID-19 and I was able to pass it, if a blood test would show that I had COVID-19 in my antibodies.
Okay.
And
let's listen to what Dr.
Would it be beneficial for me to have my blood drawn and to donate it to others?
Sure. Okay. Doctor?
Yeah, Sean, thank you for sharing your health history, and I'm sorry that you've had to suffer from blood clots and other illnesses. It may be worthwhile getting your antibody checked if you thought you've had COVID-19 or your healthcare professionals thought you had COVID-19 and you have a positive antibody. That would be suggestive, and there are studies going on to look at convalescent plasma to basically be able to donate your own blood to help save the lives of others who are suffering. There are trials currently going on nationally based out of Vanderbilt Medical Center to test whether that is effective, and certainly relies on the generosity of people like you who have been infected and have documented antibodies in their blood. So sure, that may be a possibility, and I would just urge you to connect with your healthcare professional and voice these concerns.
Thank you, Sean. Thank you to all of our callers tonight for taking time to call in. We appreciate it. That's what this program's all about. Dr. David Aronoff, thank you so much for joining us, and I'm sure we'll be talking again soon.
Rhori, thank you for having me on.
All right, thank you. We'll be back to wrap things up here on Open Line right after this. Stay with us.